Hello, everyone. Thank you so much for joining us again. We really appreciate it. I'm Dr. Towfighi, and today we have Dr. Chen with us again. Thank you so much for returning and
Thank you for
giving
the
us the
invite.
time. We worked really hard today, and we're very tired, but we're gonna be
We're
giving
gonna have
good
fun.
at this.
We're
Yes,
gonna have fun.
absolutely. Okay, so we've talked about many things before about gum disease, periodontal disease. One thing we haven't really touched up upon is gum recession. So
Yes.
if you're able to tell our listeners what is recession, what may be the causes, and then we can get into it a little bit in depth later.
Sure. I mean, recession is essentially is a condition in which you can see the gum peeling away from the roots and showing more of the root exposure and what have you. There are many causes, but some of the most common being orthodontic treatment, and certainly genetics is part of the equation, as well as some of the folks are a little heavy-handed in terms of what they're brushing and also flossing, so that can lead to certainly leads to recession.
Very good. So you're saying that the gum peeling away from the teeth, so somebody looks at their teeth and the teeth now look longer,
Yes.
basically. Okay, so all right, so big deal. We have gum recession and the gum's peeling away. What does that mean when the gum has peeled away from the teeth?
Well, structurally, it just means that you lost foundation, right, and therefore support of your teeth. And many times, patients come to us with symptoms,
Okay.
sensitivity, discomfort, and they're very responsive to temperature.
Okay, so I look at my teeth and I notice my gum kind of peeling away. Now my tooth looks longer. Can I potentially lose my tooth if that continues?
Absolutely. I mean, there's a progression to this process, and over time, if you have this condition that's not treated, where it's not being monitored, there's a chance that you can lose a tooth.
Very good. Okay, so that's what we're going to talk about treatment options. I know there's so many different options available to be able to treat gum recession. So let's talk about some of the little bit of a history. So what has all the periodontists have done to be able to treat this? What do we do? What do we do to try to treat gum disease?
Yeah, I mean, traditionally, the gold standard has been sort of taking that tissue from the donor, meaning the patient, and the grafted into the area where there's recession.
Okay.
And the gold standard meaning that everything that we've done after is measured against that. So recently, there as recent as late 80s, early 90s, we have gone into sort of the donor graft, from a tissue bank. Extremely safe, has great efficacy and results. And then the most recent, obviously, you have the pinhole, and that's what we're here to
That we're
talk
going to
about
talk
today.
about.
Right.
Okay, so when you say taking gum from me, first of all, areas, where does that usually come from?
Yeah, I mean, there are several areas, of the most common, obviously, being on the palatal area of the patient,
Okay.
meaning the roof of the mouth.
Okay.
And certainly comes with some of the side effects, the most common being bleeding and having some discomfort.
Okay.
And it's, after all, surgery. So
Okay.
it's expected that there'll be some level of side effects.
Okay. All right. So now you're saying you take the gum tissue from the roof of my mouth and place it where I have recession. So what is the purpose of why do I need to put gum? What is that going to do for me?
Yeah, I mean, the concept is this, is that if we're going to have tissue loss or foundation loss, we want to make sure that there's a way to recover some of that foundation loss. And by having the tissue reattach to the root surface, it allows us to regain some support, if you will.
So you take that gum tissue and put it where the gum is needed. What is that going to do for me?
Well, I think it certainly regains foundation, right?
Okay.
In terms of attachment, not in terms of necessarily bone support, but at least you're going to get tissue support, and that's important in terms of having longevity for your teeth.
Okay, so you're saying if I get that done, then my recession that's going to happen is going to slow down or stop, basically, because
Yes,
you have a good
arresting the
foundation
process.
now. Okay, so I know some people come in our practice and they come here for gum grafting, and we in some areas we can't really cover that root completely.
Sure.
Is it essential to cover that root that's been exposed? So I have a longer tooth. You
Right.
say you're going to put some gum in there to protect my tooth now.
Sure.
Do I have to completely cover that root that's been exposed?
No, and I think the point being, what most of our patients don't realize is that the average root is about 9-10 millimeters, and if you have a recession of, let's say, 4 millimeters, and you cover mini exposure, and you cover, let's say, 20%, 2 millimeters of that. That's a 50% improvement of what you didn't have.
Very good.
And I think that's a very functional thing to have in terms of regaining that structure.
Very good. So you're saying, just to kind of reiterate,
Mm-hmm.
so not only I will get more protected area around that tooth so the gum recession slows down, but also I can kind of get back my gum tissue that I've
Support.
lost on that tooth
That's correct.
previously. Okay, perfect. Thank you. So, and conventionally you said that we take, now you said donor tissue.
Sure.
So, okay, so that's great. You don't have to go to the roof of my mouth,
Mm-hmm.
so it won't be more discomforting afterwards. The donor tissues, where does that come from?
Yeah, it's processed from the underlying layer of the skin, and it's processed very safely, without going into the details. It's been utilized in the medicine side of it for burn victims for a very long time,
Very good.
and so extremely safe.
Very good. Okay. So now let's kind of move into, we know patients that are going to need gum recession, and we talked about a little bit why this happened. I come into your office, and now you tell me, oh, there's this new procedure called the pinhole. Can you tell us a little bit about the difference between the conventional treatment and
Sure.
pinhole and the advantages?
Sure. Like I said, and you asked a question about the traditional treatment. I do categorize essentially traditional and the new treatment. And the common ground with the traditional, meaning your donor graft, and also from the patient, is the fact that you are going to have an incision, and you have to peel the gum back in order to insert the new tissue. And there's suturing, obviously, to keep the tissue intact. Versus a pinhole is actually very non-invasive, if you will. It's a very specific access hole that we create from a set of instruments. And from that, you navigate in keeping everything intact. And so there's not going to be incisions. There's not going to be very much of suturing at all. And then you place collagen strips as the filler for the graft.
Okay, so not only you're not going to the roof of the mouth, you don't have any stitches, basically, so it's much less invasive than the conventional treatment that we've been doing
That's
for
right.
years, basically.
And then also, of course, there's the biology behind that. And biology is, as you know, we do a ton of surgery, and anytime you can preserve the blood supply, which is the support to the tissue, it gives a better chance and better results.
Very good, very good. Okay, and so with your experience, results, I mean, patients come in comparing the conventional gum grafting versus pinhole. Is it better, worse, the same, at least?
I think, it's still going back to the gold standard, right, of using the patient's tissue as the comparison. And the modalities that we spoke of today are equivalent.
Okay.
And I think the power of the pinhole is that you have more extensive and more severe type of cases, meaning more teeth are involved, is a very powerful tool in gaining tissue.
That is true, because that's a good point, because so I come in and I have every single tooth in my mouth has recession. You tell me you need every single tooth grafted.
Yes.
So how does that work for me? So pinhole, how many procedures would I have to go through to get this done?
And that's the beauty of it is the fact that the collagen that we use is readily available, and the fact is you can do the whole entire mouth in one setting.
I see. So that's
And
great.
so it's extremely convenient. Again, going back to surgery, you want to give patient the minimum amount of post-surgical side effects, and so really is like I said, a very powerful tool for an extensive condition.
I see. Very good. And then safety, you say collagen material. Where does this come from? And the patient says, what is this stuff that you're putting in my mouth? Is that safe? Where does it come from?
Right, and it's the same thing as using the donor graft. It's actually processed tissue. In this case, either porcine or bovine. And so it's very safe.
So again, I come in as a patient. You tell me I need gum graft. Why would I get the conventional treatment versus the pinhole? Because I know sometimes you may not be able to pinhole, or vice versa.
Sure.
What differentiates between
Well,
the two?
I think the modality, as we talked about, compared to the gold standard, they're all very equivalent in terms of outcome over time. But I think the key is we're operating with insurance on some of the patients, and therefore your traditional pathway are more likely to be covered by insurance versus pinholes primarily out of pocket. And like I said, the clinical condition has to do with how extensive the recession the patient presents with. And for pinhole, I tend to utilize in cases that are full mouth or an arch that's very extensive and severe. So, like I said, for a procedure is extremely powerful in dealing with sort of a more serious, if you will, and more severe involvement.
I know we are periodontists, and our
Sure.
job has been always to do this gum graft for everybody. Can anyone just go and do pinhole? Does it require some kind of additional training? Is that taught in schools now?
Sure. I mean, you would think that with our experience, we would have come up with this ourselves,
Yeah, well,
right?
yeah.
But somebody named Dr. John Chow in Southern California came up with the technique, and he's got the copyright to the process. And so you have to go through the training process to get the certificate in order to practice as a pinhole therapist.
Very good. Very good. Okay, great. So this is wonderful because that tells our listeners that there is different options available to treat gum recession. How does somebody go about knowing about this or even getting stuff like this?
Yeah, and one thing we find with social media is that patients are extremely savvy, and many of the patients actually come to us asking for the pinhole because realizing they have extensive recession from their general dentist, and they will go on social media to seek out who are the pinhole therapists in the area. And that's primarily sort of a direct contact with the patient rather than a traditional referral. And that's pretty much the primary source of how the patient comes to us in doing and asking for the pinhole.
One thing we didn't talk about was, okay, you said it's less discomforting, less invasive. So what does that mean for the patient afterwards?
Yeah, it's amazing because, like I spoke earlier with the grafting from another site, is that you're going to deal with the bleeding, the soreness, and the tenderness with the pinhole because of the tissue being intact. Some of that comes in the form of swelling.
Yes.
And that's a lot more comfortable to deal with than some of the other side effects.
I see.
And usually within the first 2 to 3 days, patients are really much back to normal, and which is a very typical inflammatory response after surgery.
You want that.
Yeah, you want that, and so we actually, for an extensive full mouth case, a week later, for the most part, they feel like they're back to normal.
I see.
Yeah.
Versus I know the conventional,
Yes.
but it's very extensive and
more side effects. Yeah.
Very good. Well, thank you so much. It's wonderful information, and thank you so much for joining us. And
Thank you.
Giving you our expertise. Thank you so much for listening to us. Really appreciate you coming back and giving us the time to listen. And again, remember always, the healthy mouth, healthy body. Thank you, Dr. Chen.
Thank you. Thank you so much.
Bye-bye.
Thank you all for listening to the Healthy Mouth podcast. As a reminder, the information we provided in this podcast is for educational and information purposes only, and it is not to substitute medical advice, diagnosis, or treatment. Please check with your family doctor or professional advisor before using any information provided in this podcast.
The Healthy Mouth podcast is co-hosted by Leo Applegate and Dr. Paul Towfighi. Our executive and technical producer is Johnny Flores, and our video producer is Aaron Zaragoza. A new episode is available every other Thursday.